wide range of autoimmune disorders. We expect there to be a lot of questions on this subject, so we thought we'd open it up to some additional questions. Would you like to take one?
Sure.
Do we have one? Yes.
I was diagnosed in 2011 with Myasthenia Gravis. It's a rare neuromuscular disorder. What is the most challenging situation for someone diagnosed with Myasthenia Gravis?
That's a great question. So Myasthenia gravis, as you mentioned, is an autoimmune condition. And often what happens with patients, as I'm sure you're very well versed in this, is that the muscles get tired, usually over the course of the day, especially with repetitive motions. And it can happen to any muscle in the body, not just the limbs and the arms and the legs, but even things like the eyelids and the muscles that we use to chew. So it can be very difficult. It can be very debilitating. I think for patients, there's a few things that can be very hard. Of course, the symptoms. It's tough to deal with. It's tough when muscles fatigue, and especially towards the end of the day and after repetitive motions, that gets very hard. But I think something else I brought up, which is the emotional aspect. I think all of these conditions, and so many others, emotionally, sometimes it's just hard to cope with. And to understand the condition that you have, and to sort of deal with the ups and downs that sometimes naturally comes with these. So as a physician, that's something I've seen with my patients that can be particularly difficult to deal with.
And does a support group help?
I think they can be very, very helpful. I really do. Support groups can be helpful. Sometimes it can just be a pastor or a clergy person at church. Sometimes it can be a group of girlfriends who you can run interventions on if you need to and sit around and chat. But it's got to be sort of a trusted group of people or person that helps you feel whole again. And helps you get that feeling of normalcy that sometimes I think is hard to feel when you're facing autoimmune conditions.
Thank you, Dr. Caudle, for coming on the show and helping us start the conversation, and for shedding some light on the complex warning signs of those mysterious illnesses.